I think implants have become so prevalent over the last 20 years because they're such a revolutionary technology and because they're so much better than what we had before. And complete dentures, we know, unfortunately, on the bottom, lower jaw, you have a tongue, it moves around, the bone's often very thin there, and you often have a lot of movement. And there's reasons why patients a lot of the times can't tolerate eating with a denture. And when that's the case, then implants are going to be able to actually screw these prosthetics in where they can't move, they're fixed in place, and you don't have to worry about that. And you can dial in the aesthetic component too, where you can recreate a smile to a patient's liking. So you can tweak the tooth shape, the color, the morphology, and all of that can be really dialed in to fit a patient's wishes.